and justice day and night to achieve its goal.
Citizens of the planet, it is my high privilege and my distinct honor of presenting to you the Prime Ministers of the Public Health Union.
Thank you so much for joining us for this State of the Union on the health of so many communities that are marginalized, that are disrespected due to institutional patriarchy and racism and colonization that we see. And we know that the health impacts are severe and deadly and have been going on a very long time because of the fossil fuel industry. And so we're really honored to make this presentation to the health community nationally and globally, because it is a crisis and we need to address this. And we know the health community has an enormous amount of power to help us in this advocacy work to end the era of this fossil fuel destruction and to move us to a clean energy future. Thank you.
Hi, I'm Rashetta Sibley Ozan. I am the founder, director, and CEO of the Vessel Project of Louisiana here in Southwest Louisiana. My organization, the Vessel Project of Louisiana, was founded in the midst of several natural disasters that we experienced here in Southwest Louisiana from 2020 to 2023. Those events include Hurricane Laura, Hurricane Delta, Winter Storm Uri, and a flood that was historic in the Lake Charles area. During the course of those storms, many residents in low-income BIPOC communities were left homeless and found themselves losing everything and having to start over. As I was helping those community members, I was finding that there were so many other issues related to what they were experiencing, and I tried to dissect what was going on in those communities. All of these communities were surrounded by oil and gas industry, petrochemical facilities, listening to people talk about their health and their children's asthma issues, their children's skin issues such as eczema, and how that impacted them after these storms that caused them to lose everything. I started connecting the dots with how these things were related and how do we get to the center of the problem. Why were these storms so intense and back-to-back in these years? And also, why were people experiencing other issues such as health and environmental issues around these facilities? And so BIPOC communities, Black, Indigenous, people of color communities in Louisiana, I found are disproportionately impacted by pollution due to a long-standing systemic racism and economic equality. So I started the Vessel Project as a mutual aid organization that turned into a case management organization and started going after these oil and gas industries to show the direct relation between the people who were in those communities suffering, what they were suffering, and why those issues were highlighted in the aftermath of disasters. Some of the issues that I found were poor air and water quality, increased health risks, and decreased quality of life. These communities are often unable to access resources to help combat the pollution and its effects, leaving them vulnerable to long-term consequences. It is important to recognize inequities in pollution exposure and take action to create a healthier, more equitable environment for all Louisianians. And we do that first by looking at the root of the problem, and it's the oil and gas industries are already overflowing in Louisiana, but we have several more that are proposed to come here. And those proposed to come here are still targeting those low-income BIPOC, low-income white, low-income people of color, indigenous communities, their land and their soil. We have fish eating advisories here. We have toxins in our water. And a recent study showed that several of the sites here in Southwest Louisiana, we don't need any more industry to come here.
Hi, my name is Monique Verdin. I'm a citizen of the Houma Nation and WECAN's Southeastern Food Sovereignty Coordinator, helping to support the Oklahina Iquish Holo network of Indigenous gardeners who are based mostly here in the other part of South Louisiana and South in the sea. We are facing a heartbreaking reality, which echoes what we just heard. The truth is that I come from a place known as Cancer Alley, just north of the dead zone, where we're losing land at one of the fastest rates on Earth. The latest statistic is that every 100 minutes, a football field is lost from our shores. As you might imagine, they call it Cancer Alley because it's got a reputation. Though for years, industry has tried to claim that the cancer clusters near facilities have nothing to do with the byproducts of their business. Though we know that many of the communities between Itihoma, Baton Rouge, and the Gulf of Mexico have some of the worst air quality in the nation. And new studies are bringing unsurprising evidence to light that connects industry to health disparities in fence line communities that many Black, Indigenous, people of color, Creoles, white folk simply call home. 7 communities in Cancer Alley are among the 10 census tracts with the country's highest cancer risk from air pollution. And according to the EPA, a community known as Reserve has the country's highest cancer risk, 50 times the national average. Here in the Delta, the legacy of corporate interest built the foundations of the plantation economy, where sugarcane fields once grew, petrochemical plants now sit, occupying the rich wetland territories where water flows through in relationship to cycles in life. And the headline was, Louisiana has 8 of the worst water polluting refineries in the country. Heavy metals, nitrogen, ammonia are spilling from oil refineries, tainting the Mississippi Gulf of Mexico. This report found that South Louisiana refineries are discharging some of the highest amounts of heavy metals, nitrogen, and other pollutants into our rivers, estuaries, and waterways, and claims that the United States Environmental Protection Agency and state regulators are doing very little to stop the 500 million gallons of wastewater that pour from US refineries every day. Chemicals like selenium, benzene, mercury, and cyanide are just a few of these nasty byproducts, which the EPA has never set limits for. And there are outdated federal standards that are not even enforcing and have failed to keep pace with water treatment methods. We must remember and recognize that many communities along the Mississippi River are pulling their water supplies from the river, drinking it every day, hydrating their babies, washing their bodies in river waters. We must respect the river and her rights if we are to protect the health and well-being of all life that depends on her health and well-being.
The Women's Earth and Climate Action Network has released a report that exposes the role that financial institutions play in preserving and perpetuating negative gender and racial impacts due to the financing of fossil fuel companies. And based on analysis and evidence that links fossil fuel activity to women's health, safety, and rights, the report advocates for financial institutions to divest from fossil fuel companies. The report finds an indisputable connection between the fossil fuel industry practices and negative impacts to Black, Brown, Indigenous, and low-income women's health, safety, and human rights. Specifically, fossil fuel-derived air, water, and soil pollution impact women's fertility, mental health, and daily work and responsibilities. And just one example, in 2022, the Houston Chronicle reported that various Houston sites were flaring, releasing toxins that exceed the permitted levels they are allowed to emit for the entire year. Notably, Houston's eastern neighborhoods, which are downwind from flares and therefore the most exposed to flare chemicals, house a majority of Houston's Latina population. Flare toxins significantly increase the risk of preterm births and other health deficits for mothers and fetus. So this is a very serious issue, and we deeply appreciate the advocacy work we see growing by health professionals worldwide in our collective efforts to end the era of fossil fuels and move to a transition that is just, that is clean and equitable and healthy for the energy future of everyone. Thank you.
Only the victim remains a victim while the truth slips through the system. Yet the goodness never sees the light of day. So we fight for what is right against injustice day and night. To achieve this goal, that's the only way. Yeah. Somebody's colorful. Someone is.
Hello and welcome to this State of the Public Health Union. I am Alfredo Moravia. I'm the editor-in-chief of the American Journal of Public Health. If you have sound but no picture, I'm a white male with white hair and glasses, and behind me there is a screenshot of the latest cover of the journal for the March issue. And if you have a picture but no sound, you can turn on the closed caption, and here you won't get my accent, but maybe for the accent I would say I'm a New Yorker. So another couple of things, the last 30 minutes of this webinar will be dedicated to questions and answers from you. So please use the chat and send us your questions and comments, etc. And we'll try to discuss them here. Finally, the session is recorded, so you'll be able to watch it again on APHA now. Okay, let's start. And let me introduce to you our guest. The theme of this State of the Public Health Union is diversity, equity, and inclusion in all policies. So we've gathered people that are involved in public health action of some kinds in a lot of different areas, like the environment, and you just heard Osprey and her colleagues, the workplace, Native communities, universities, and also scientific publication. So let me start by introducing to you Osprey Oriole Lake. Osprey is the director and founder of an association, which acronym is WECAN, and which means Women's Earth and Climate Action Network. And it has another term that is international, because this is an international coalition of grassroots movements that fight to improve the environment and reduce the impact of climate change. So Osprey, welcome and thank you for this address. We had, as you know, the editors of the American Public Health Association elect the Prime Minister every year. So they elected you, and we got 3 Prime Ministers. That was a very good deal. Thank you very much.
Thank you. It's an honor. Thank you.
So then we have Michael Bird. Michael Bird is a Native American, a Pueblo from New Mexico. He's been the first Native American who was elected president of the American Public Health Association, and is currently an advisor from an organization that helps retirees in Native communities. Michael, great to have you with us.
Thank you. Appreciate the opportunity.
Then we have Adam Kader. Adam Kader is the center director of an organization in Chicago called Arise Chicago that groups organizations that are faith-based or workers' organization to promote equity and health and justice on the workplace. Adam, nice to see you here. And you also have a master in health policy, if I remember well. Thank you for being here. And then we have Alison Berry. Alison Berry is a doctor. She got an MD and an MPH from Johns Hopkins. She's currently a county health officer in Washington State, Clallam Jefferson County. And she was already my guest at the plenary session of the American Public Health Association meeting in Boston this year. Welcome, Alison, and thank you for being here.
Thank you for having me.
And then we have Tom Leviste. Tom is a sociologist. He is dean at Tulane University School of Public Health. And he's also a filmmaker, a very talented filmmaker whose last movie I saw and I highly recommend. It's called Skin You're In, How Race Influences Health Equity. Thank you for being here, Tom.
Well, thanks for having me. It's my pleasure.
So you see, we have a very diverse group of representative people who are actually acting and in order to improve the health of the public in a lot of different communities. So let's start by, we had just this address by our three prime ministers. What are your reactions? Just let me know how you reacted. This was the first time you saw it, I know, for most of you, for all of you except Osprey.
Well,
I thought it was wonderful.
It had an impact on me living in Louisiana. I very much recognize pretty much everything that was stated in that address, and I'm actually looking forward to following up with the people in that film to see what we might be able to do together. I think the address hit on the theme that I think is the critical theme, which is the political determinants of health. So when you look at what really is the thing that undergirds all of what was talked about, it was political decision-making. And we are in a country that is a democracy and people have the right to vote, but consistently we vote against the interests of the interest that would best support the public's health. And I think that's where I think we need to start looking at. Why are people voting against their own best interest? And why are we electing political leaders that will allow the conditions that was just described to continue to exist?
Thank you, Tom. Alison, you were going to say something.
I was going to say, I think it did a wonderful job of highlighting the fact that most health issues start long before the doctor's office, and they start with the environment that we live in. Mm-hmm. As a person who works in local public health, in the day-to-day work of public health, I think it's really important for those of us doing this work to understand that we are working within systems that were built on unjust foundations. We are all working within a system that is systemically disenfranchising the poor, the underserved, marginalized groups. And we have to know that, and that has to be a key driver of our work. Those of us who have access to the halls of power have an obligation to speak in service of the communities that we serve who don't have access to those spaces. And it was really wonderful to see people doing that work and fighting for these groups. And I think we in public health have an obligation to elevate those voices and to push for policies that would better serve these people.
If I may.
Yeah, sure, Mike.
Well, for me, as someone whose people, as an Indigenous person and someone whose people have been here since time immemorial, scientists would like to say around 20,000 years, but since the beginning of time, as far as we're concerned, I view this from a historical, cultural, and a legal lens. And to Tom's to a point that was made earlier, I think, yes, it's political, but it's also historical. In New Mexico and in many reservation areas, but particularly New Mexico, the whole uranium industry defined Native communities and Native lands as national sacrifice areas. And uranium was mined and Native people were put at risk as miners. And the land was contaminated in the process of obtaining that uranium that continues to poison people to this day. And the remediation efforts have really fallen short. And we also have, again, very similar to Louisiana, high pollution because of mining and because the petroleum industry, which is significant in New Mexico and in Arizona. So many of these things, and for me, the final analysis, it really boils down to greed and selfishness. When we talk in this nation about what we value, about valuing human life, about valuing humanity, when it runs up against financial interests, all too often we see financial interests being given a priority, and it benefits some but not all, and there's a downside to it. So I just think it's not just political. If you really look at the history of this nation through an indigenous lens, you see that people were not valued, and you see how genocide played out in this nation.
Thank you, Michael. Adam, you wanted to say something, or
yes,
on the
well,
address?
the address was very powerful, and our Prime Minister was correct in emphasizing that it's really the communities that are most affected by so many other injustices, and that furthermore need to be at the forefront of designing the solutions and the interventions to remedy those. I think that it's important to remember that these are the same communities that are experiencing poisons and dangerous exposures in their community, in their environment, are the same ones that are most disproportionately employed in low wage and precarious jobs. And we have to remember that most poor people are spending more time in the workplace than they are anywhere else. So when they are exposed to hazards at work, and when they are working under policies and conditions that have implications far beyond their workplace, that is equally important to be looking at when we think about public health as both what's happening in the workplace and outside. Many members that we represent spend more time in their workplace than they do in their community, than they do in their homes, and they do in the lives of their children. So what happens in the workplace has profound impact on what happens in their family life, in their civic life, in their political life, in their community life, spiritual life. And so really when we think about environmental protection, we think about public health interventions, we must always also think about how are we making sure that those that are in the most low wage, most precarious jobs, how are we centering using an economic lens, in addition to the many lenses we're talking about. But how are we making sure that we are looking at the most marginalized workforces in these conversations? Because as I think we would all agree that a rising tide raises all boats, as they say. I think furthermore, we have a common enemy in unfettered industry that is curtailing our political rights. As my colleague talked about, right? It's the same industry groups that are curtailing voting rights, the same industry opposition that are eroding environmental protections, and of course the same industry groups that are fighting against workers about workers' own democratic rights in the work site. So I believe that we have a common purpose and a common opponent in front of us, a formidable one, and that's all the more reason why we should be having panels like this, bringing our voices together.
That's great. That's great. I just remind you that the reason for this parody, the imitation of the State of the Union, is to bring, to give a voice to persons and groups that are really at the forefront of the public health action and don't have this type of podium usually. And I mean, this first conversation really demonstrate that this is worth it, and also that there are lots of synergy. So let's go into what each of you in your specific field of action would like to see coming in the coming year in terms of improvement. Who wants to start?
I'll go ahead and jump in. Well, first of all, thank you for hosting this forum for all the reasons that you said, Alfredo. I think it is really interesting, and thank you to all the other esteemed panelists. It's really wonderful to meet you all and to have this opportunity to have this discourse. And first off, I just wanted to respond and thank you for your comments, because I think that, as an organization that is focused on climate, but specifically with a gender lens and also looking at marginalized communities, in response to your comments, but also looking forward, I think one of the things that we need to realize is the level of intersectional crises that we now face, from the climate crisis to the economic crisis, to racial crisis, to immigrant crisis, and the intersection between all of these crises and the systems of oppression that we're all collectively facing that ultimately also affects our bodies and our health. And so I just wanted to name that because we do know that, as an example, since my address particularly focused on the fossil fuel industry, and there are others that have been mentioned, like the uranium mining that is going on that Michael pointed out. We are looking at extractive industries and the fact that we are on this economic model based on endless economic growth. And that very foundation is now becoming more and more exacerbated wherever we look in any sector, from health to well-being to education. Any sector you look at is being impacted by the fact of this systemic extractive industry and extractive economy, where we cannot continue to live in endless economic growth and have the wealthy and the elite continue their systems of oppression. And this is where it really falls down on the need to have inclusivity and diversity, as you were talking about, Alfredo, because we do know, just looking at the United States, but it is also global, that due to the fact of inequality, and Indigenous and Black and Brown and low income communities are being impacted first and worst by all of these different intersections of crises because of white supremacy, because of colonization, because of the infrastructures that we have. And we need to really call that out, because as we see the increase of climate impacts and environmental degradation and economic crises continue to unfold, the communities that are going to be hurt first and worst are Black, Brown, Indigenous, and low-income communities, because this extraction is not happening in wealthy communities. This extraction is happening in what are called sacrifice zones, and to sacrifice people, and in what are called sacrifice zip codes. So I think it's really important, as we look going forward, that we really take on the lens of equity and how we're going to navigate these multiple intersectional crises, so that we really do see justice-centered, people over profit, and really take on a lot of these industries and their political actors who work in cahoots with them, and really gain power together in different spaces from different backgrounds, different types of groups, so that we can collect enough people power, if you will, to turn the system around. And that is my hope for this year with all of you. Thank you.
Thanks, Osprey. Who else? Yes, Michael.
Well, I think, first of all, I agree with everything that has been stated, but I want to share, and we face similar challenges, but there are some unique differences, and we need to be mindful of those differences. And I just want to share a quote from Dr. Martin Luther King, who was courageous and visionary. And this is what he had to say about Native populations. Our nation was born in genocide when it embraced the doctrine that the original American Indian was an inferior race. Even before there were a large number of Negroes on our shore, the scar of racial hatred had already disfigured colonial society. From the 16th century forward, blood flowed in battles over racial supremacy. We are perhaps the only nation that has tried as a matter of national policy to wipe out its indigenous population. Moreover, we elevated the tragic experience into a noble crusade. Indeed, even today, we have not permitted ourselves to reject or feel remorse for this shameful episode. Our literature, our films, our drama, our folklore all exalt it. Our children are still taught to respect the violence which reduced the red-skinned people of an earlier culture into a few fragmented groups herded into impoverished reservations. And I would say, I'd also have to say, as someone who's been on this earth for 71 years as a Native person, that one of the greatest challenges that we face today, and in my professional career going back some 30 or 40 years, is the fact that Native people in so many arenas are still invisible. And even in the public health academic arena, in financial institutions, any sector, you will be hard pressed in many cases to find Native representation at any point in time. And I can, to the record, I'm the first Native person in 2001 to have ever served as president of the American Public Health Association. There was no one before, and I'm working on ensuring that there is someone that will follow. But that gives, if you just look at that, one Indian in 150 years, and we're progressive, we're committed to equity, we're committed to diversity, we're committed to all those things. And if we're so committed, I think there's still a lot of work to be done in our house, much less anywhere else.
Absolutely. Absolutely, Michael. There's a lot to do. Anyone? So let me say, yeah, please.
Oh, I was just going to say, to really Osprey and Michael's point, I think a critical part of this is understanding that these outcomes are not accidental. They didn't just happen, and they aren't breaks in the system. They are the system. We have an author out here, Ijeoma Oluo, who says that the system works according to design. These are the outcomes the system was built to create. And we have to know that, we have to acknowledge that, and we have an obligation in public health in particular to work to build better systems. I'm not a proponent of, some of the activists I work with have kind of a bit of a burn it all down goal. I'm not an advocate of that, because I know that the vulnerable will be hurt the most. But I do think that we can build a system that's better. And if we want to see why the outcomes come this way, why people appear to vote against their interests, or why these particular groups get sicker or work in the worst possible places, we have to know that that outcome was intended. We have built a system that prioritizes the profits of a few over the lives of the many, and over the lives of a particular group who we wanted to see hurt. And if we know that, we can work to build better policies, and we can take the hard stances. I think I also want to encourage my colleagues who have access to leaders, to political figures, that sometimes when you take a hard stance against wealthy and powerful people, you sometimes get a lot of pushback. People get mad, but you have to be willing to take that anger on yourself, because otherwise you're just throwing the most poor under the bus. If you won't take the hard stance, then you're just saying that their suffering is okay. You have to be willing to stand up, say difficult things, and push for change for the people that we serve.
Yeah, I couldn't agree more with that. This is why I focus so much on politics, because politics is where decision-making is made. And back when I used to actually teach health policy courses, when I had the ability to teach courses, I would tell students that in health policy, we basically can reshape the world. We change the rules about how the world functions through policy. And policy is what shapes events, and events become history. So it's the politics and policy that determine what the history is, and in that history is ultimately what we live through and how we engage the world that we're living in. And I think it's really critical for that those of us in public health become sophisticated about how to operate within the political realm. So most people, I find, think that the way that you shape policy is that you go to the state legislature or the Congress or the city council and you get a new law passed. And certainly that's helpful. But after you pass that law, there's implementing regulations that actually determine how those laws are implemented. And you can weaken a well-intended law to the point of it being ineffective by creating a weak regulatory structure around that law. We need to understand that. We also need to understand that not all politics happens within the political, within electoral policy. For example, there's no city council. Well, I shouldn't say no. There are unlikely to be city councils around the country where they're passing laws and saying, okay, we're going to make this community a food desert and that community not a food desert. It's corporate policy. A lot of the policy that impacts how we live our lives are being decided in the corporate boardroom. And if we're also not thinking about that form of policy and how we can be effective in that realm, then we're missing a lot of what is going to determine what kind of world that we're going to be living in. So it's critical, I think, that we understand that politics, we always talk about how it's impolite to talk about politics. I never say that. I do not think it's impolite to talk about politics. I think we must talk about politics because that is what determines how we live. And that, and to my friend Michael, that is what shapes history. The policy, the politics creates the history that we live through.
I think that's absolutely right. And furthermore, I would just add that, the engine for politics are movements. That it's people demanding is what creates the space for politics to happen. If it creates the space for policy to happen, the stronger the movement, the stronger space there is for policymaking. And as Thomas said, when something's passed, that's just the start, because unless there's a movement that is willing and able to do something with that, I feel like policy is only as good insofar as it widens the space for us to organize it. And without an organized constituency, there's no hope for policymaking. And I think that's all the more reason if we talk about wishes, a wish for public health, mine is for public health to continue to increasingly see itself as a movement. That's because, we really have no choice but to move forward on any of our different fields on these different issues, but to act in solidarity. And I think that we can only act in solidarity if we think in terms of movement, because there's no denying. I mean, we witnessed the entire public health field, the very notion of a public health, be disparaged, attacked, questioned, delegitimized throughout the experience of this pandemic. And that is, that sort of attack is all too familiar to those who are in the labor movement. And so, like it or not, we've been put in the same boat because, again, there's been the same attack on the very premise of the common good. Be that the common good in our environments, in our community, in our workplace. So, again, I think that, the spirit of this panel today, it embodies that very idea of solidarity. And I think that that's my wish for public health, is to embrace that embattled position that it's been put in, whether it likes it or not, and to find common cause with these other organized constituencies, these other movements, if you will. And I think there's great precedent for this already. I'm very proud of partnerships we have in Chicago with the public health community and the labor movement. I think we're a great example and model of how we see these our fates as intertwined.
Absolutely. And I mean, the discussion is touching some very fundamental aspect of public health. One is that, there is no public health without democracy and participation from the people who are on the front line. I mean, when this doesn't happen, usually it leads to catastrophe. And so the movements that are grassroots, frontline organizations that are really have access to the communities that most need the public health action and intervention are indispensable for public health to exist. I think this is one very important aspect of public health. The other that people here are mentioning is the all-inclusiveness. That there is no public health that excludes anybody. I mean, public health has to be all-inclusive. It's only when we have a collective response, to a collective threat that we can succeed. And we need to integrate everyone, whatever their personal or community characteristics are. So that discussion shows those types, and clearly there is synergy between all your different fields.
Well, Alfredo,
yeah.
I would say over the course of my experience in public health and the course of my life, I've heard people talk about equity, diversity, and social justice, and they would talk about it. But the thing I've discovered is that it's one thing to talk about it, it's another thing to do it. Where I stand now is, don't just talk about it, show me what you're doing, show me what you've done that demonstrates that there's a real commitment to those values. And if you can't show it, then you're not doing it. And I'll say now publicly, there are far too many places in my own personal experience, and I can only speak for myself as an Indigenous person, that there are far too many places where you'll be hard pressed to find American Indian representation. And it has to do, quite honestly, with the genocide and the extermination of 80 to 100 million Native people in the Americas that took place. But what we now see is a virtual genocide, because we're not included, we're not involved, we're not consulted. And one of the fundamental principles that this country had when it made treaties and with Native populations was to, in fact, see us as having not just the communities of color, but actually, as having a government to government relationship with this nation that we're still waiting in the form of treaties and executive orders. And we're still waiting for this nation to fulfill those commitments, the land that was taken, the lives that were lost. Promises were made to Native populations in terms of health, education, and those promises have been empty. By and large, those promises have never been fulfilled, which goes back to the point that was made earlier about if you don't have will, and if you don't really have it, you can put anything in writing. It doesn't mean anything if there's not the political will, if there's not the organizational commitment and people pushing the systems to be responsive to, in fact, meet their needs. Some accountability.
So the challenge I think we have is figuring out, how do we motivate political will? And those of us who work in the equity space, we rely on social justice arguments to do that. And the challenge there is that we've probably already got as many people under the tent that are going to get under the tent on the basis of the social justice argument. So I think people get it, and they either care or they don't care. And so one of the things that I've worked on over the last few years, and we're actually doing this again now, is a project where we calculated the economic burden to the U.S. economy of having racial inequities in health. In other words, what does it cost the economy to have these highly inefficient inequities? The first time we did it was in 2008. And we calculated that cost as $1.24 trillion, right? Which is about the size of the economy of the country of India, which is at that time the 11th largest economy in the world. So it costs money to fix the inequities, but it also costs money to maintain the inequities. And I think the more we start to work on other arguments we can make beyond the social justice argument, and a particularly economic argument, because that is really where most of the policy, as where this conversation is bearing out, most of the policy is being made on the basis of economic arguments. And if we can figure out how to frame arguments using the economics that would produce the outcomes that are just from a social justice standpoint, I think that's what we need to start thinking about. How do we get to that place?
Yeah, I wanted to thank you for that. I wanted to weigh in on that as well. To make a few points. One is that I think that we cannot underestimate a lot of these extractive industries. So when we're making these economic arguments, we really need to know who we're standing up against and what their next 5-10-year goals are. Mm-hmm. As an example, when we're talking about all the health impacts that have happened from the fossil fuel industry, which is in Louisiana, which is in Indian country across the United States, which is happening around the world. The fossil fuel industry is well aware of the health impacts of their industry, yes, as well as, let's not leave out of the room, the impending climate crisis that is destructive to everyone and all life on the planet. And they are one of the wealthiest industries in the world. And so we're up against also something that is not logical in terms of the fact of people actually caring about what's happening to other human beings and caring more about their profit margins than they care about the survival of humans, let alone those on the front lines of these impacts due to racism and colonization. And so I think when we're talking about economics, we need to also keep looking at what are alternative economics to the endless economic capitalistic system, because right now that is the system that we have. And whether you're talking about the fossil fuel industry or mining industries, extractive industries, and the financiers, meaning the banks, asset management firms, insurance companies, they're all working in that same system to continue to produce and extract. And so we need to also understand that even though logically it doesn't make sense from a health perspective, all of these systems are designed to keep going forward and distracting and kicking the can down the road with false solutions, such as different kind of carbon offset schemes and all kinds of things that they continue to promote to look as if they're taking action, but they're actually not, because they're designed to continue to do exactly what they're doing now. And the last thing I wanted to say, because I really want to honor Michael and your comments about Indigenous peoples, I really want to highlight the fact that even here in the United States and Canada, we see on the front lines again and again of water protection, which is central to all of our health. Indigenous peoples have always been on the front lines of protecting and being water protectors at great, great cost. And it's not that a lot of other groups have not stood behind them and been big allies, and we've all in our movements collected together. But when you're talking about the Keystone XL pipeline, Line 5, Line 3 from Enbridge, the MVP pipeline that has gotten a lot of press lately, we're talking a lot about Indigenous leaders standing up to protect the water and warning the world that we are destroying our Mother Earth. We are destroying our ecosystems. And I do think we need to really look to Indigenous peoples and their worldview and what they have offered all of us for generations about how to live on the lands where we live. 80% of all the biodiversity left on the earth, which is how we live as human beings, is in the hands and lands of Indigenous peoples. And there's a reason for that, which is their understanding of how to live in harmony with the natural laws of the earth. And I didn't want to leave that out because I do think there's a specific place of learning with Indigenous leaders. I know for me, Indigenous women specifically have been some of my most important mentors about understanding the land and how to live with nature in harmony and in a way where we are enhancing our environment versus destroying it. And I think that that's very important in this conversation as we look to transition off of the current economic and social systems we're in. Where are we moving to? And I think we can look to a lot of Indigenous knowledge around the world, including Indigenous peoples from Africa, all over the world. Where can we look to this Indigenous knowledge of how to live in harmony with the land, which will, of course, affect our health?
I think the last two of you that I spoke have both spoken to the fact that there are some limits to persuasion, right? Of who the folks that are already going to be on board are kind of on board. There and that whether we come up with new ways of persuasion, whether it's frames of understanding economic impacts, whether it's expanding people's worldviews, to learn more. I think that we run up against, sooner or later, the hard truth that, persuasion has its limits. And at some point, we have to move to a place of coercion, maybe, I don't know what the word would be, but of people just taking power, using power against those that are unwilling to learn, unwilling to change their value system. I think that, the hard truth is that the leaders of industries, they may be good people individually. I think going for a moment back to diversity, equity, and inclusion, I think that too often people take the shortcut to thinking that representation is it and enough. We've seen over and over again that representation is a foot in the door, But unless we're talking about redistribution, if we're talking about racial redistribution, if we're talking about diversity in terms of redistribution of wealth and power, that we are not going to see those changes because the systems are bigger than the individuals that inhabit them. We can and should continue to promote more diversity in positions of power, but if the systems of power that they're embedded in remain the same, which by all indications they will, we are eventually going to hit a ceiling. And so I think that's why we have to think about who are the people that are best positioned to openly contest and take power from industry. And I think that so often that means starting with workers themselves, given that they are the ones who are able to withhold their labor and to bring this nation to a halt. We saw that very dramatically over a health issue, largely when the railroad workers recently were poised to shut down the entire transportation in this country because they wanted sick days. They wanted paid sick days. If I don't see if that's not an intersection of public health issues and labor, I don't know why any of us are here. And so I think that when we understand ordinary people, not just activists, right, but ordinary people who have an immediate self-interest, like a paid sick day, if we can help lend solidarity to a simple request that will directly impact a concrete material gain for a person like that, that person becomes well positioned. That's an opening for them to understand their own power, and also for them to think about how do they do things that are going to impact other people like them. That to me is the route. It's not persuasion, but it's showing people their own power through something that benefits them, and then guiding them, bridging them to what the next bigger fight is. Because if transit workers are in a position to shut down the country over a sick day, they're also in a position to shut down transportation over other demands, public health demands, bigger demands, solidarity demands with other communities. So I think that we need to understand that ordinary people have unbelievable amounts of power when they're organized, and when the advocates, the people like us in the room, are in a position to help draw the connections for them between their immediate self-interests and the other larger issues that are of interest to all of us.
I hear you, Adam. The only thing I want to make sure people also understand is I feel that there is still a lot of space to explanation and convincing. I mean, in particular in public health, I noticed that many people still don't know exactly what public health is. Is this your assessment too, Alison, that sometimes when we're talking about public health, people have different idea of what it is?
Yeah, I'm of the mind that I actually don't think we've reached everyone yet. Certainly, I think there's a dedicated cadre who are on board, but there are so many people throughout this country who I think do really care about their communities, but haven't been engaged in the work, haven't been shown the connections, as Adam was saying. And I think that is what gives me some hope, actually. As Osprey said, we are up against really challenging forces. When we saw public opinion turn hard against the public health response in the pandemic, that wasn't accidental, that was driven, and that was encouraged by powerful forces that wanted that to happen. And that's happening on all of these spaces. That's happening on climate justice, that's happening on labor. There are powerful, largely companies, wealthy people who want a certain outcome, and they are very good at driving the public conversation. So we have to know that, and we have to be as good, even though we have to be better, even though we don't have the kind of money they do. But what we do have is we have care for the people and the truth on our side. And I think that it's important to remember that things don't just get better. Society doesn't just get better on its own. It gets better because large groups of people got together and demanded that it would. And so I think we can do that, and we can continue to work to mobilize affected communities to demand better. And those of us who have access to power can echo that and amplify that to demand better. And I do think that we are at a point where there is such synergy between our causes that I think we have an opportunity to really change things moving forward.
That's great. At this point, I mean, we are 35 minutes before the end, and I would like to open for the question of the public. I didn't even have time myself to talk about our initiative at the journals, but you can find them in the journal. I won't insist here. I want to open to look at the first question that we have in the chat. This is Kristen Francis, and the question is, what are practical ways to affect corporate policies that disadvantage certain population? So we talked about a little bit the principles. So in practice, how do you do, and are there synergies between what you do in terms to reach those goals?
You mean within the corporate sector? I mean, so I think the civil rights movement and the Black community was effective with that. I think we were just talking about the train strike that was recently averted. So there are ways, but the way you do that is you do that by, you have to appeal to the economic argument. That's the thing that is driving that decision making. So we have to be able to show that it is not in their economic best interest to do certain things. So the example of the railroad strike was an example there, where it was not going to be in the economic interest of corporations to allow that strike to happen. So they had to do something about it. But public opinion doesn't always work. I mean, so over 95% of voters in surveys are for background checks for firearms. Over 80% of Republicans are for background checks, and over 80% of NRA members are for background checks, but yet we still don't have background checks, right? Because power overrides, can override public opinion as well. So I think the real fundamental issue here is who has power, and how do we, those of us that are coming from the perspective that all people in this conversation are coming from, how do we move from speaking truth to power to becoming the person who is in power, who then gets to make those decisions? I think that's the next phase that we need to be focusing on.
Right. Okay. So, apparently everyone agrees, and I would say I agree with you, Tom. So let's move to the next question. It's Edward in rural Virginia. If public health is supposed to include everyone, why are there so many provider shortages in rural areas? And I think that's a very important point, because sometimes people think that people, some people don't have access to public health because they don't want public health. No, it's because the service is not there. And so what can we do to improve that and to guarantee that there is service where it's needed?
So I live in a very rural area, and we face a critical health access shortage throughout our area. Part of that actually comes from working conditions. I think we have to talk about that. It's not an accident that so many people are leaving the healthcare field right now and not wanting to be nurses anymore. And I think we have to speak about that. We can't fix this problem by just continuing to make people work longer hours. We have to figure out how to actually recruit people into the field, make sure there's enough training spots, and make sure that the conditions that they work in are conducive to humane care of the people they care for. I think one of the things that's starting to come to the fore more is the idea of moral injury of medical providers. Most of us go into this field because we really care about people and we want to help them live better lives. And then you get into a system that forces you to see a new person every 15 minutes and turn away people who can't afford to pay. And it is crushing if you actually care about your patients, which most of us do. And so I think we need to reform the healthcare system to make it so that we can actually do the work that we went into this to do. And I think in the rural areas in particular, one of the challenges we have is because there are so few of us, if you get here, you just have to work so incredibly hard because there's no one else to back you up. And so I think recruitment, improvement in working conditions are probably really critical, and looking at alternative models of delivery. So community health workers, how can you support community members who are parts of these community to actually take care of their own community? I think we often have a bit of a a classist bent in medicine. We think you have to have a bunch of fancy letters after your name to do the job, but much of this work can be done by people already living in these communities if we're open to that idea and supporting their development and their care.
Speaking,
Yes, Michael.
speaking as a failed IHS bureaucrat for 20 years, couple things come to mind. One is that when you have a system that's only funded at 40 to 50% of the level of need, you're going to have challenges in terms of maintaining providers. Also, I think that that there is there is this whole. I was involved for a period of time in terms of of supporting dental health aid therapists, which are mid-level providers that can do many of the procedures that dentists provide, and in rural areas you can't. And the model was developed in the folks in Alaska, native tribes up there, realized that they couldn't meet the needs in their community, so they adapted a model from New Zealand, developed it, implemented, and of course ran headstrong into the American Dental Association, and who was totally opposed to it. But it has made significant progress across the country. Many states have adapted and adopted the model and adapted it, and it's being rolled out. And so there are innovative, creative ways, but in many cases you have vested political, economic interest who oppose anything that is contrary to their way of doing things. And so again, I think it goes back to some of the conversation we've had before, is that we have to really, what really is going to meet the needs of people. And there are other countries who've already developed models, who've already done, who have better health, as we know, have better health status. Their communities and their populations are healthier than this nation, who has more in the way of resources, but who has a system that fails to meet the needs of all people.
But there's also a point, and because you're all here, I think some communities, so-called hard to reach communities, they wouldn't trust anybody else than organizations that are from their community. So what can we do to integrate, grassroots organization, community-based organization into the implementation of policy? And Tom was mentioning this at the beginning. Also, how can academia contribute to solve some of these issues?
Well, I think one of the things that I think is really inspiring and very nascent that is interesting to look into, and our organization is very much expanding our program, is around community-led food sovereignty and food security networks that also combine growing traditional medicines. And we see this happening, Indigenous and Brown and Black communities, particularly, who are in food and medicine deserts in many regions, not just here in the United States, but other regions. And I think this is very interesting because it's a very comprehensive approach in terms of understanding, as you who are health professionals know, the relationship between the actual food that we're eating, the environment we're in, and the quality of the health of the food that we're eating, the water that we drink, where we're living, our relationship to that food, and the relationship to the medicines. And I think that there's a lot of traditional ecological knowledge from Indigenous peoples and people who have been close to the land that were caretaking for their communities before the industrial complex of medicine took over, if you will, which is another institution that has its own issues. And I think that this is a really grassroots growing movement, where we see it combined also with land back for Indigenous peoples, reparations for Black communities, where we're seeing community gardens happening in the city and food forests being grown. And I think it's a very interesting space where we're seeing both urban and rural solutions through the growing communities growing their own food, growing their traditional medicines, and figuring out how they're going to create their own economic benefit as well to these new systems, where we're getting localized, where it's the community growing the food, growing their medicine, going to traditional healers, and of course, not Xing out the incredible import of the medical profession. I'm not saying that at all, but it also is something that can work economically, socially, environmentally. As you know, even one of the projects we're involved in is around having to first remediate soil that has been poisoned through fracking. So we're also having to deal with how do we heal the land to then grow healthy food, to then have a healthy community. So it becomes very comprehensive in terms of helping the grassroots communities, as well as urban communities, where we have, as I said, these urban farms growing, where people are taking back power for their food, for their medicines, and for their health.
And I think a large part of
Yeah.
that is recognizing community resources. We talk so much about, disparities and lack in these communities, but we also need to recognize how much strength exists in these communities too, how much experience exists. One of our greatest successes in the pandemic, many people don't know, but in Little Forks, Washington, there's actually a large migrant community of Mom-speaking migrants from Guatemala. And one of our greatest successes was connecting with the women of that community. And they were dedicated, they were smart, they built their own mutual aid society, and they would walk around to all the different trailers in the trailer park and knock on doors and deliver vaccine and make sure people were safe. And all that they wanted was someone to actually talk to them and speak to them in the language that they know. And they had so much to give, but no one had ever acknowledged that they had that before. And that was all it took, was actually checking in with them and asking for their help. And they already knew how to take care of their people. We just needed to engage them in the process.
Yeah. All these testimonies, they show that one crucial aspect, essential aspect of public health is that it needs to be bottom up. It cannot be only top down policies. This doesn't work. Historically, they go to catastrophe, and we see the richness of what we can learn from communities in order to achieve the goal of improving the health of everybody. And there is a question, I thank our public, we have lots of questions here. We won't be able to address all of them, but Tasha Brantley has a question which I think is a very important one, because it touches at it's about prevention versus treatment. And public health is really about prevention. And she's asking, what can we do policy and system-wide to advocate for more preventing, proactive public health approaches and get away from the current maintenance, big pharma pushing healthcare? Tom.
Well, the Affordable Care Act tried to do some of that, right? That was one of the goals of the Affordable Care Act. I would point out that only 25 of the 50 states expanded Medicaid. Meaning that while the Affordable Care Act is one of the most important things to happen from a health prevention standpoint, the benefits were not distributed equally, and of course, it may actually wind up in the long run exacerbating the inequities, because when you look at the states that did not expand, they are the states with the worst health statistics. They are the states that have been the epicenter for economic, social, political, and health inequities, both historically and today. They're the states in the Southeast for the most part. So this is, again, I think this comes back once again to politics. The people that live in those states, Louisiana, by the way, is the one state in the South that did expand. So I say something positive for my current home state. But you look at the other states, I've asked the policymakers in some of these states this question. I said, don't the people of Georgia pay federal taxes? Yes. Or aren't those federal taxes what's being used to pay for the expansion in the other states? Yes. So the people of Georgia are paying to expand healthcare in Maryland, in New York, and Maryland, and California. Well, I thank you for that, but is that, but again, so the logic doesn't follow and you don't get the prevention because the policymakers decide not to do what was necessary to make those benefits available. So again, it comes down to the politics and why do we continue to elect the legislature and governors that do not enact policies that benefit the people of the states that they live in?
The other,
Yeah, please, Michael. Yeah.
the other piece of this, as I see it, is really looking at the history of different populations and different communities. Because when you go back in the history of Europeans first encountering indigenous people, they described them as universally healthy, strong. They had their own crops, they had their own gardens, and obviously that their native indigenous communities were impacted by Europeans. And of course, the first foreign infectious diseases came from Europe. You know, those were the foreign diseases. And one of the things I've done research, studied, and developed a video on titled Windrunner was the history of indigenous running in the Americas from North to South America. It was a common practice. They were messengers. They promoted health and well-being, and that actually was adopted by the Indian Health Service, and many tribes throughout the Americas all had indigenous running systems, and that's been it's been brought back as a cultural value and a cultural tradition, which promotes activity in terms of not just running, but walking and any kind of physical activities. And many Native communities are more engaged in that than ever have been in the past, going back some 40 years when I started with the Indian Health Service, where all you heard was the negatives. All, you know, you're all depressed, you're all alcoholic, you're all abusive, you're all of these negatives. The message from professionals was a negative message, and there was no positive message to counteract the fact, because they didn't know the history of Native people. They didn't know what the positive values were and traditions and practices, such as farming and physical activity and physical activities that promoted the health of the communities. So it's oftentimes the narrative that is sold.
Yeah, but
Well, and particularly-
Alison, please.
I was just going to say that speaks to your original point, which is understanding the history of how we got here. You know, it's not an accident that Native communities have lost access to traditional ways of living their lives. That was intentionally done. And that can help us when we try to rebuild community, that can help us approach it with a bit more humility if we acknowledge how this came to be. And I think a key part of prevention work that I think is important for public health is we have a tendency to approach communities with a good bit of hubris that, you know, you don't know how to cook for yourself, and we're going to tell you how to eat healthy, without acknowledging that there are reasons why people are eating unhealthily or why they don't have time to exercise because they work 80 hours a week. And I think if we want to motivate change, we have to look at the structural barriers that are standing in the way of successfully living a healthy life, and approach people with that humility. I think along that same line, it's critical to understand intergenerational trauma and how that plays out in people's inability to live healthy lives. In addition to being a public health professional, I'm actually still a primary care provider 1 day a week. And I particularly work with people who are struggling with addiction. And all of my patients have trauma. And a big part of bringing them back to a better direction in their life is to help them rebuild community and rebuild connection with their own history, with their own family, and dealing with that underlying trauma that's driving unhealthy behaviors. And I think if we approach our patients and our communities that way, we not only will be more decent to them, but we will have a lot more success.
There's a whole history of boarding schools, and that's finally seen the light of day in terms of Deb Holland's, the study that was done and what it's revealing, because the whole intent of this country, this nation, was to destroy Indian people. Kill the Indian, save the man. That was the intent, and it was part of federal policy, and it has resulted in what we see today. The consequences are still playing out in families that were broken and damaged, in individuals that were damaged in many ways. And And there's never really been to this point an accounting for that.
Yeah, absolutely.
I'd also like to just add in here, I completely agree and, really appreciate the comment, Allison, that you're making about communities and how, and also with you, Michael, continuing to talk about the historical analysis, because I think if we don't know where we've come from, it's really hard to unwind where we need to go. Otherwise, we just sort of deal with things that pop up and try to heal that small moment. But then the next issue comes up because we don't deal with the trauma, we don't deal with the history, and we don't look at the systemic problems. And until we do that, it's very hard to have the depth of healing that I think we all know is possible and wish for, but continues to get interfered with either through a lack of education historically, these big power structures of companies and corporations and financial institutions that are fighting against people and planet. And so we do need to have this very holistic approach to how we're going to really create these systems of change. And I think within this, I would also, and not surprising to any of you, coming from a women's organization, like to bring in the lens of a feminist analysis. And the fact that also, when we look around the world, when you see women's leadership, when you see women in roles of power equal to male colleagues and across the gender spectrum, we see a very different outcome. And I think we cannot leave out patriarchal institutions into the issue of racism and colonization. Just as an example, during the COVID-19 pandemic, it was shown again statistically that countries that were led by women did far better during the COVID-19 pandemic. When we look at the Women's Political Empowerment Index, and we see across the spectrum of what's going on with reducing carbon emissions, if you just have a 1 degree increase in the Women's Political Empowerment Index, you get an 11.5 degree decrease in carbon emissions in that region or that country. That's huge, 11.5%, all because of the way that women are looking at politics, caring for their families, and the kind of history that women have had in terms of their own oppression and the duties that they have in their families. So I just wanted to bring forward also that when we're talking about the systemic change, the role of women's leadership is also something that we need to add into the mix, because we have been living in not only a system that is endless economic growth models, these power structures that we've been talking about, colonization and racism, but we have also been living historically for thousands of years of patriarchy. And this toxic mix has to all be unwound simultaneously. So I wanted to add that into the conversation as well.
This is fascinating. Let's listen to Madison Spellman. She has a question. Reformation of the healthcare system is needed, but where do you think we can start? And I want to emphasize also related to this question that we still have a system that is very imbalanced toward medical care and not towards prevention. I mean, the first contact that most of the people have with the health system is, the emergency room or the individual practitioner. I mean, public health is very limited. That's why a lot of people believe that public health is just health for the poor. I have my private health, and public health is for those who cannot afford having an insurance, etc. So, I mean, how can we use the opportunity that this pandemic has given to public health to show how effective it can be, to start reforming the healthcare system and increasing the prevention side of it?
I think we have had quite a few successes in this pandemic, and it has often been when we really focused on the common good. So with COVID-19, we had to consider the health of everyone. You couldn't just sit in your little box and focus on the health of the few. And we saw that worked. So making sure that vaccines were available and free to everyone who wanted them, any part of the country that did that did better. Making sure that COVID-19 treatments were available and free made sure that people did better and people didn't overwhelm their emergency departments or overwhelm their hospitals. And we did that by making treatment available to everyone, whether or not you could pay, whether or not you were documented for the first time in a long time. We made sure that people could get care, whether they had citizenship papers or not. And we found that the health of everyone got better when we did that. And I hope that we, as a community, hold on to that memory and apply it more broadly. I think many people don't know that that's going to go away, that when the state of emergency goes away, that we will lose the ability to do so many of those things that people have actually come to expect. They've come to expect that they can get Paxlovid if they want it. That's going to go away in May. And I think the only way it doesn't, and the only way it expands, is if people demand it. And I think we need to help people know that that's changing and that they could demand a system that works in a more equitable fashion.
That's absolutely true, and a very important point, Alison. We're getting there soon. I mean, there's a time that we need to act extremely fast. I wanted to ask Adam, you know, what are the opportunities to improve prevention on the workplace? Is the situation good for that type of movement?
Yeah, well, I think, of course, the pandemic, for the first time, we created publicly, there was a new category called essential. And, I think that's, on the one hand, it was a contradiction, because on the one hand, people talked about heroizing, sort of people that were just showing up to work, when talking to our members, I don't think they saw themselves as heroes. I think they saw themselves as the unlucky ones that, were told that they could not work from home, and were, had to choose between their financial and their physical health. But I think what it did do is two things. It did cause workers to reevaluate how much they were willing to put up with on the job, because the stakes were so much higher. And I think it also caused the public, and those of us, who were able to work from home, to also reevaluate, to develop some consciousness around what people were going through. I think the contradiction, of course, is just that we did not see policy follow through and deliver and we did not treat, workers as heroes as such. But I say all of that because I do think there is an opening. I think we've seen a renewal in workers demanding more, especially when it comes to health and safety. We've definitely seen that in the last couple of years. People, frontline workers who are exposed to the public, certainly the Starbucks workers that are unionizing, are very much, very much on the front line of, public-facing, workers. But we also see, the public rallying behind that cause. So I do think there's an opportunity both for, there's been a movement of new allies to workers in these positions, and workers themselves reevaluating. But I just think that, despite the public health's best intentions, despite the greatest programs and opportunities, I think fundamentally, if people are insecure in their employment, if they are overworked, if there's too many hours, if they are facing, severe economic hardship from not being paid their full wages, from having, wage theft issues, to, having, unpredictable scheduling, I think fundamentally, if there's not that sort of basic security, people simply are not going to have the capacity and wherewithal to access the best designed programs. I see our organization, which is not a service provider. We are an organizing group that helps people, build power. Nonetheless, functioning in some part, particularly during the pandemic, as a bridge to these services that folks otherwise would not have accessed, including, access to vaccines. We actually hosted a vaccination event for our members and held it in a neighborhood church, and had the local public health board administer vaccines during the pandemic for that group of workers. We were confident that so many of those workers would not have otherwise found a way to get the vaccine. So, I think that, there's going to be a limit to what can be done with the best, public health programs if we're not addressing core capacity and stability of working people, which is the workplace.
Absolutely, but I wonder whether prevention is not the common ground, for all of the organizations that are represented here, for the environment, the workplace, indigenous communities, for the public health, local public health departments, and also for academia. Whether around this theme of prevention, all these other aspects that has been discussed today, the political, the economical, etc., all those different fields, could rally and create a common movement.
Yeah, I mean, prevention is having the chance to live inside and working in a place that's safe for a reasonable amount of hours. It's having sick days. I think that would be a very reasonable point of advocacy that I think many of us learned the value of in the last few years. We should all be able to stay home when we're sick, not just because that's decent for the person who's sick, but it prevents sickness in everyone else. That should be something that is just guaranteed across the board for everyone in this country. And it's not, but we could demand that it is. Another critical, kind of to bring the feminist lens that Osprey was talking about, another critical need we saw was childcare. You can't work if no one's taking care of your kids. And because of the gender dynamics of our country, that is a burden that has been disproportionately borne by women. And we have to talk about that. We have to make sure that people have access to safe care for their children. Otherwise, none of the rest of this works.
Mm-hmm.
I really appreciate, you bringing in, Adam, so strongly, the worker perspective and the incredible importance of the labor unions and all the work that's happened. So I really wanted to thank you for that, because I think it often gets left out of the conversation. And so I really appreciate your perspective and advocacy. And I wanted to also, I know we only have a few minutes left here, mention something that I found really inspiring from the health community, which is, we know that we're facing multiple crises in the environment, and all of the issues of lack of access to health that has been mentioned. And we do know that this pending climate crisis is coming, and the key foundation of it is the fossil fuel industry and carbon emissions in the atmosphere. And something I've been really inspired by is something called the Fossil Fuel Non-Proliferation Treaty, which I'm on the steering committee of. And basically, it is a treaty that is working to get all governments to agree on phasing out fossil fuels rapidly so we can move to a clean energy transition. And the reason I mention it is that there's a group of health professionals that wrote a very powerful letter that we have been using with governments and with the financial sector that is very interested in perpetuating the fossil fuel industry. And it holds a lot of weight for the health community to come together behind this treaty to stop fossil fuels or advocate with governments. And in so many other areas, we've been really moved by how much the health community has gotten behind our reports and been endorsers of our reports because of the authority that the health community has. I think I just really wanted to sort of end my comments on the role of advocacy that the health community has and the tremendous power you all have to influence politics, to influence public health, because of your expertise and what you have to add to the role of decision makers. So thank you for that.
Yeah. Oh, thank you, Osprey, and I also praise you for your advocacy on domains that environmental justice. I think you've been extremely effective, you and your colleagues, and we thank you again. We are getting to the end of this webinar. I enjoyed it enormously. I hope you did too. I want to say that the journal is engaged in the process of understanding how diversity, equity, and inclusion can be promoted in scientific publication. We have a several-year grant with the Robert Wood Johnson Foundation to develop guidelines about how to do more equitable science and produce it, and also incorporate themes that are just and equitable. So I want to thank the Robert Wood Johnson Foundation for funding this project too, and this webinar. And finally, let me finish with simple words. There've been 220 million people fully vaccinated in this country. This is about 70% of the population. Any president that would be elected with 70% of the vote would brag about it, but we don't brag in public health, but we can be proud of it. And this is an opportunity for us to improve it. Thank you.